Yeah, good morning and good afternoon, depending on what time zone you're. And thank you very much for this opportunity. Um, my topic is a qualitative research, and the topic is a holistic insight into the privacy and security of cloud-based computing approach on healthcare information management system in the US, the grounded theory approach, which is part of my dissertation research. For introduction, Gartner, I use some quotes or use some quotes out there. Gartner Cloud Shift Research study predict that a substantial increase in cloud adoption with public cloud solutions poised to constitute over half of IT spending in key segment. And one of the key segment there that I'm studying is the healthcare. So I look at precedence research in 2002, the projected surge on the global healthcare cloud infrastructure market from 39.7 billion in 2020 to 157.8 billion in 2030. Then a recent study by Duplo Cloud in February of 2023 last year, which involved 500 United States healthcare IT professionals, found that 70% have adopted cloud computing, with another 20% planning to do so within 2 years. This was by DS in 2023. And I look at some of the major healthcare institutions that we have in the US, and one of them is Mayo Clinic, which is a world-renowned hospital. And in 2019, by right, they went back to a 10-year partnership with Google Cloud, marking a significant step in a digital transformation. So this is not just, I'm just trying to indicate that cloud computing adoption within the healthcare is not just for within small institutions, even major institutions, healthcare institutions are involved. And two of the main forces that are driving cloud computing adoption in the healthcare space, according to Kiel et al. In 2022, is computational power and communication capabilities. In this sense, the healthcare organization or healthcare institutions, they've been generating a lot of data lately, and most people are getting sicker, the pandemic and all that. So all that data and all we need heavy computational power. So I believe the cloud is giving them that. So it helps collaboration between users, which is simplified collaboration. Infrastructure and service costs are reduced, agility and scalability are boosted, and flexibility is among the many advantages. So that's according to MedTech et al. In 2021. So yes, there are benefits in the cloud, but there are also challenges associated with healthcare data privacy, transparency, and risk management. This one is by Marymount. So in 2022, the Human Health Services Office for Civil Rights, they received 590 reports of healthcare data breaches. More than 48.6 million people are affected by the breaches, compared to 40 million in 2021. So these are some of the challenges that we face in the healthcare. So this brought about the purpose of my study to take a look at. It's a qualitative research study, as indicated earlier, to investigate the privacy and security of cloud-based teams in the U.S. healthcare sector. And while I'm investigating that, it's also to develop a theory through data analysis to provide a holistic insight into the privacy and security of patient care data stored and processed by cloud-based teams. And I'm going to use the grounded theory methodology, which is an inductive process to develop this theory. So for that, I develop a research question, because for me to be able to develop the theory, I have to develop, formulate a research question. And the research question is based on literature, relevant literature, and is shaped by the methodology. So my research question is, how has cloud-based computing approach to HIMSS improved the privacy and security of patient PHI in the US? I know we've seen benefits, we've seen challenges. So we're trying to look at the privacy and security aspect of it. So why am I doing this? It's because, first of all, the healthcare industry is a critical infrastructure here in the United States, and these HIMSS are essential for managing PHI. And PHI is critical to patient well-being because it contains all patient information. So it is imperative for U.S. healthcare organizations to grasp the impact of cloud computing on the privacy and security of patient data, because any alteration to patient data will affect, the public health and the well-being of the patient, which is critical. So this study aims to offer comprehensive insight that will enable healthcare providers to enhance PHI security and uphold patient trust in the healthcare system. So I look at some key references, some related work here that guides my my research. Some of the key references is, as I indicated earlier, I look at the benefits of cloud computing, its ability to provide accessible, reliable, and cost-effective patient data storage. And also the benefits are there, but also there exists a significant risk to patient time. And digitalization is one of the things that is driving a lot of this cloud adoption, especially now we have telehealth, in which one of the reports, according to 2021 telehealth survey report, 85% of physicians are using telehealth services. And but it's very important before getting into the cloud, institutions understand the cloud, the relationship between cloud adoption and IT department efficiency, more or less develop a cloud adoption roadmap that will guide them towards it. And Ishmael in 2020 talks about it. And within the research, I use the tool framework, which looks at the technology, the organizational, and environmental impact, how they shape technology adoption, such as cloud computing. So it's important that before healthcare organizations adopt cloud computing, they have an understanding of the regulatory aspects of it. This is when we talk about HIPAA. The HIPAA side is not just within the internal organization, but also when it comes to like the cloud service providers, the cloud service provider services, the HIPAA compliant and all that. So it's more of a shared responsibility in this case. And patient participation is very crucial. So because we're here to manage patient data, and the business objective of any healthcare organization is to improve patient healthcare delivery. So the patients are central when it comes to it. And but so far so good. Most of the cloud misconfiguration has been like one of the major issues. And one of the researchers saw there is was in 2019, and now there is a recent one that would, but this one said indicate that there has been a lead in exposed records from 11.8 billion in 2018, costing organization approximately 1.76 to 21.2 billion in 2019, with a damaging cost of 3.18 trillion. And according to Prada in 2022, it's like many businesses face challenges due to lack of necessary cloud-based skills, which might lead to cloud misconfiguration. So these two are interrelated. So without the skills, a lot of misconfiguration. So it's important that training and development is part of the cloud adoption framework for healthcare organizations. So I'm going to use grounded theory as I indicated earlier, which is an inductive process-based strategy in constructing and extending the knowledge. And according to Conteh, particularly in areas where established theories are inadequate. So grounded theory will help me to address some of these gaps, because some of these key references, they look at it, the benefit, the challenges, the regulatory aspect. So that's why I'm looking at a holistic insight that brings all this together. So for me to achieve this, this is my methodology right here, and I'm using the grounded theory methodology developed by Glacier and Strauss and Kathy Chemers. And the grounded theory approach is essential for ensuring validity and reliability in research studies. It encompasses a series of steps: identifying a research problem, formulating a research question, data collection, data coding, and analysis and theory development. Page 2005. So I'm here as the researcher. The first thing I have to do is identify the research problem. From there, I formulate a recite question, then do my data collection. My data collection, in this case, the instruments I'm using here mostly is interviews and direct observation during the interviews. That's what I'm going to be doing during the data collection process. And there I'll develop my memos. If you look here, there is a loop here. There is iterations here. So it's a back and forth. So data collection, review and refine, and constant comparison and additional analysis. So this helps me to review and refine my data, make sure that my theory that I'm going to develop is grounded on the data that I've collected. But for me to be able to do this, also, it depends on the type, it depends on the population, because I have to have the right people, I have to have the right data. So my present study is focused on a select group of participants, and these are from a healthcare organization in the Washington, District of Columbia Metropolitan Region. So there are 10 individuals, a mix of nurses, nurse practitioners, IT professionals. And these are people who interact daily with patients. These are people who interact daily with cloud-based teams, who use cloud-based teams as an end user and who are there to also do the configuration provision of cloud-based systems. So I decided to use purposive sampling. The reason why I'm using purposive sampling is so that I can select participants whose characteristics are well aligned with the study requirements, so that that's when I can get the right data, as I indicated that. People who are the end user of cloud-based teams every day, and people who are there in the configuration and provision. So purposive sampling approach is instrumental as it facilitates data targeting directly relevant to the research question, objectives, and things. On the data analysis, I utilized MaxQDA, which is a comprehensive tool for coding and analysis. And if you can see here, this is my coding, my data analysis phase. My first phase is data familiarization, wherein I'll get myself familiarized with the data. For me to get familiar with the data, it helps me to develop memos, which gonna help me at the end of the day when I'm developing my theory. Then there's also the grounded theory coding phases. Phase 1 is the initial coding process. I'm going to use open coding. Phase 2 is the systematic categorization of initial code. In this case, I'm going to use focus coding. Then I put sub phase 2 because I'm going to do comparative analysis. In this case, I'm going to use code relations browser here for me to do my comparative analysis, wherein I'm going to try to see the relationships between the categories and the codes. Then phase 3, I'm going to do a systematic formulation of a core category using selective coding. Then I'm going to run another comparative analysis. In this case, I'm going to look at my themes and patterns, how they relate to my data set, and then develop a code theory model using max. This is the final concept. It's an abstract conception on how the themes and the patterns are related to represent the data. So in the data familiarization, I examine the data. You know, the thing about grounded theory is, as you receive the data, you start analysis. You don't wait until after everything. So collect the data, start the analysis. From there, during my analysis, the first thing is data familiarization. As they come in, I review all the interview transcripts. And from the reviewing, I use MaxQDA Memo Manager in order for me to jot down or write down my reflections, on what I noticed, or or what is prevalent, for all the transcripts I reviewed. One of them is cloud transition tech. And one of the notable cloud transition I see mostly on the the IT specialists are talking about, and as far as also the nurses is the collection, because they've been using paper documentation. So the collection and organizing and sharing of all the paper documentation, that was a major concern there, because they have papers in drawers and boxes and all that, and they have to digitize all those papers. So there was a major challenge there for them, moving them safely, making sure you know, no data breaches while they are doing that, or they don't forget something or expose something that, patient information they don't want to expose. So that's one thing I was able to identify there. And there was also a learning curve there because there's a new technology coming in. This goes down from leadership all the way down to other staff or the rest of the staff members. So that one for the learning curve, I look at this one, I wrote this one, that learning curve for cloud-based solution. It's a new technology. So I know that there is a gap between technological advancement and user adoption. So I pay attention to that. But there are also some benefits most of them talk about. In this case, now they can use multi-factor authentication. There are risk analysis on both sides for both within the CSP and which are the cloud service providers, and themselves. So there are some proactive security approaches here, continuous auditing and reporting, end-to-end encryption. And I put there technology versus human factors. This one comes again, the interplay between technology and solutions and human factors. So I jot this down on the frame memo as part of my memo, which memos the Max QD, manager instrumentally grounded theory, providing comprehensive documentation of the reflection, emotional responses, and consideration. It helps me when I'm developing my theory because I'm going to go back to see if my theory answers most of these my reflections or all of these my reflections. So I went now to the phase one. I use open coding, which is a data-driven coding procedure. I don't know if you guys can see this clear, but these are the codes that I generated when I did my open coding, and here is showing. I don't know if I can make this bigger. Just for you guys to see it. Improve patient care delivery, and as you can see here within the data set itself, this is one of my open codes. As a result, this is improving patient care delivery by eliminating patient care delays. So all I'm trying to show here is that from open coding, I started making sure that my codes are grounded on the data that the participant provided, right from day one, making sure that everything is grounded on the data, make sure that the data more or less guides me throughout the coding process onto the theory, onto the theory development. And throughout here, I use code memos for each and every code. The yellow things here, these are all code memos. Wherein for every code, there is a memo. So in case, like when I'm doing my analysis, there's a code I see, I will know exactly why this code is applied, why this code is here, and what relationship these codes have within each other. So after the initial coding, the most important part now is for me to do focus coding, which is an in-depth, examination of the initial codes. As you can see here, these are here is just codes. Then when I move here, I develop categories. Developing the categories in the sense, I start looking at codes. I start looking at the relationship between the codes, what relationship they share. And if you look here, we have cloud benefits. And within cloud benefits itself, if you look at the codes that are there, these codes highlight the positive impact and advantages of adopting cloud-based systems in healthcare. Then security measures is the category there, and the codes here share the theme of specific actions to secure patient data in cloud-based systems, which are access, Then compliance and regulations. These codes that directly address the research questions focus on privacy and security improvement through regulatory adherence. You can see these are all financial and compliance, HIPAA, policy oversight, service level agreement. Then we have training and development. This could stress the importance of training and continuous learning for the staff to use and manage cloud-based teams effectively. The codes are distinct from direct security measures, focusing on human factors and learning. Then here we have the challenges and the risk. Codes highlight potential challenges and risks the healthcare organization faces with a cloud-based. So benefits, security, compliance, training and development, and risk. And the plus signs here just shows that these are match codes. from the initial code. Some of these codes are merge code as codes that you have dominant codes that share similar empirical properties. So I merge them, and that's the plus. Then I did a comparative analysis, and my comparative analysis is for comparative analysis. It's very important in grammar theory, and I use the code relations browser. And the good thing about the code relations browser is, it helps me for me to able to see, the relationship between the codes. So if you can see here, this is for cloud benefits, this is for security measures, this is for compliance, this is for training and development, and this is for challenges. So in this case, I use it because I've already derived the categories from the initial code, so it's important for me to see the relationship and co-occurrences between codes without the data. So this helps me ground the emerging theories and codes on the provided data. So it makes me, I'm able to know that all these codes and categories, they share similar relationships that is grounded within the data itself. Then selective coding here, it helps me, I use selective coding for me to develop my core category, which, selective coding is an integral process within the grounded theory methodology, allows for the emergence of theory directly from the data, abolishing the need for preconceived hypotheses. So looking through all the main categories, subcategories, and codes, and making sure that I've already done my comparative analysis, make sure everything is grounded. So develop a core category, and the core category is holistic security, privacy, and reliance in cloud-based systems. So holistic looks at all this, regulatory, technology, security, capacity building, of course, and resilience. Resilience comes down to data loss preventions. It more or less look at incident response and all that. So, of course, I conducted another comparative analysis here. In this case, now I use Code Matrix browser from MaxQD. In this case, for the Code Matrix browser, the difference between that and the correlations browser, here I'm looking at the themes and patterns within the entire data set, within the documents, and comparing them within the document itself. That is the interview transcript itself. And as you can see here, we have, we have specific themes here. Let me just take one, for example, like security here. You can see right through, right through the data set. Some things talk about access control management, continuous monitoring, and alert data transmission integrity. The same for training and development. And if you look at technology and infrastructure aspects here as well, there are cloud challenges, but at the same time, there is improved efficiency in data breach. So there's a duality here. That means even though there are challenges, there's still improved efficiency going on, which is very important. This is a very important aspect for me to note. So at the end, the final phase is developing a code theory model. And this is my code theory model from using max maps. Within the code, this is my core category itself. Then from there, we have the main categories. Then we have I show the subcategories here, and the memos that are developed throughout the process. So this shows that there is a holistic, insight here that connected to all these main categories, as well as the subcategories and the memos. Everything is grounded together. So the privacy and security of cloud-based hints here in this case is showing a holistic insight as the topic defines. So what I did here is some of my findings, I put some of the themes on participant survey responses for improved efficiency. Due to cloud HR, patients orders can be put in immediately, and wherever the patient might be, it doesn't matter the state of the county. wherever the patient might be, you can have the lab work done without necessarily coming to the provider's office. It will also automatically be in the system, making it easy for the provider to access the patient lab result. So this is one of the participant responses showing improved efficiency due to cloud-based EHRs and access control management. This is patient 6 because I named them by, I create acronyms. And this is patient 10 here. As I mentioned, the cloud has security features for continuous monitoring and auditing that will help us audit all patient data access logs. The Identity Access Manager also centralizes employees' access and enables the organization to assign roles as the means of access for every employee. This means employees can only access the patient data they are assigned to access. So this is for access control manager. Same for HIPAA compliance. Patient data is also now organized with the cloud. And training and development. What was done regarding PHR, of course, is utilizing that multi-factor approach to log in to access patient data and staff training. A lot of staff training for reinforcement of knowledge. So these are some of the improvements in privacy and security that the cloud that I just choose. I try to choose one from the training and development area. This is from the HIPAA compliance governance. This is from security. And of course, this is from the cloud benefits itself, improve efficiency. Well, I face some limitations. Some of the limitations of the studies, the non-technical capabilities and sufficient cybersecurity knowledge among healthcare professionals, which, of course, they were able to explain some concept or some technical concept, some cybersecurity related concept they were not able to. That's a little bit of a limitation. And the most important one here is the sensitivity of healthcare data. The highly sensitive nature of healthcare data imposes restriction on how much information. So it's hard for me to even to get is there any data breaches or occurrences? So questions like that will never be answered. And the busy schedule, it was very difficult for me to able to get them. These people are very, very busy. So it was a busy thing. It took me time for me to be able to get those 10 people to sit down with me and provide me the data that I use there. But you need careful planning. So I would say use focus groups. Use secondary sources of information to help getting this data. And recommendation for future research. This research is mostly based on just cloud-based, based on the entire cloud-based teams. I will say a key area to extend, conducting a corporate across cloud-based deployment models like public, private, and hybrid cloud models. Currently employed in US seems to ascertain, relative effectiveness in safeguarding PHI. For this can uncover critical insight into which cloud-based approach offers superior privacy and security features. They'll look at variables such as data encryption standards. So they'll compare this different models, see which one provides, a more effective, of course, there's going to be a cost benefit analysis being done here. So then, of course, it's going to look here, and it's going to enhance the understanding of strengths and weaknesses in different models. So that's my recommendation for a further study. So in conclusion, the core theory model analysis indicate that cloud-based systems can strengthen the protection of patient PHI in US healthcare. But this requires a thorough, multifaceted strategy throughout the cloud adoption process. Like I show, it's an holistic. You cannot just look at the technology side and forget about, the regulation side. Cannot just look at the regulation side and forget about the technology or, side. So everything works together. So healthcare organization can, with precise cloud adoption and implementation strategies, can define their cloud-based security and privacy posture to protect the confidentiality and integrity of patient-sensitive data such as PHI. And HIPAA, just I was saying, yeah, you can implement security and privacy services, but you need a comprehensive regulatory and compliance plan that promote the security and privacy practices. So, so it's essential for healthcare organizations to comprehend the shared responsibility model of cloud computing to ensure effective security and privacy. So before getting there, get a cloud adoption process, a roadmap, then understand the shared responsibility model, then understand the security and privacy goes beyond just implementing them, and That's my conclusion.